Thanks for joining us again on the newsroom. Edo State has discharged 13 recovered COVID-19 patients and also recorded 5 new deaths from the disease. Governor Gordon Obaseki confirmed this in a tweet on Monday morning. He said one of the deaths was recorded at the Stella Obasanjo Hospital and 4 at the University of Benin Teaching Hospital. Obaseki further revealed that most of the deaths are persons above the age of 60. The new deaths bring the total COVID-19 related fatality in Edo State to 24. Meanwhile, emerging data shows that no fewer than 400,000 people have died from COVID-19 related deaths since the virus first emerged in China late last year. Official AFP tally says a total of 400,052 deaths have now been recorded, a figure that has doubled in the past month and a half. While almost half of the deaths have been recorded in Europe, the United States remains the hardest hit nation with 109,802 deaths from 1,920,061 cases. Britain is next with 40,542 deaths, followed by Brazil, Italy and France. A public health physician, Adebayo Akintayo, has thrown his weight behind the Presidential Task Force for the new guidelines on treatment and discharge of COVID-19 patients in the country. Speaking to TV360 as Deji Badmos, Dr. Akintayo said the decision is based on scientific evidence and owing to economic restraints. It's important to modify management procedures as more infections have been reported across the country.
Judging against the background that we are in a low resource setting country, we don't have all the necessary resources to throw around just like it happens in other places. So we have to ensure that we are using scientific knowledge to make informed decisions in order to prioritize how we are going to dispense our resources. But I can assure you that if the information, if that protocol change will adversely affect the welfare and the well-being of the people in the community, I'm sure the medical practitioners would not allow that to happen. So it's an informed decision that is based on scientific evidence and again on the basis of the economic resources available to, at our disposal at this very moment. The most critical period when the infection will be more is within the first week. Then after the first week, the viral load, depending on the immunity status of the person, may gradually wane down. And as a result of that, particularly when people observe all those public health precautions that we have highlighted out, which includes social distancing, physical and social distancing, universal application of masks by everyone, the personal hygiene protocols as well, the hand washing and the decontamination of frequently touched places. By the time all those ones are adopted, to a very great extent, gradually we will develop what we call the herd immunity.
The Nigerian Guild of Editors, NGE, has called on the federal government to extend its financial interventions to media organizations in order to save them from collapse due to the effect of the COVID-19 pandemic on their revenues. In a communique released over the weekend, the editors explained that such funding was needed to protect jobs and ensure the continued existence and operations of the media organizations. It added that the dire state of the media has now been made worse by the COVID-19 pandemic, and there is an urgent and very compelling need for the Nigerian government intervention to save the media from total collapse. The Guild specifically recommends the injection of funds by the federal government not only to help keep media jobs, but also to ensure the continued existence and operations of various media houses. We'll take a break now and we'll be right back. 2 persons have died in a renewed clash between 2 rival court groups in Orukanam local government area of Akwa Ibom State. The spokesman of the police in the state, CSP Ndwam Frederick, confirmed the incident to newsmen in the state. Frederick said some persons had been arrested in connection with the killings. He added that the Commissioner of Police in Akwa Ibom had directed the anti-cultism units of the command to take charge of the area. The Global Network Against Food Crisis, GNAFC, and the Food Security Information Network, FSIN, has projected that 7 million Nigerians would suffer acute hunger in 2020. In its 2020 Global Report on Food Crisis, the group said the food scarcity would emanate from food supply crisis predicted to last from June to August 2020. The GNAFC and FSIN said in Nigeria the total number of acutely food insecure people during the June to August 2020 lean season is forecast at 7.1 million, and that's over 40% from the same period last year. The situation poses a threat to the actualization of the Global Sustainable Development Goals SDG Target 2.1 of ending hunger and ensuring access of the poor and vulnerable, including infants, to safe, nutritious and sufficient food all year round. Experts say conflict and climate change may aggravate the tragedy if actions are not taken urgently. The presidency has been explaining the reason for President Muhammadu Buhari's delay in forwarding the nomination of Justice Monica Dongban-Mensem as the president of the Court of Appeal to the Senate for confirmation. Justice Dongban-Mensem, who had been recommended by the National Judicial Council to succeed Justice Zainab Bokachua, who retired in March, is presently occupying the position in an interim capacity. Senior Special Assistant to the President on Media and Publicity, Garba Shehu, denied claims that Buhari has refused to send the judge's name to the Senate because she is not a Muslim and does not hail from the core north. Shehu explains that the statutory time for her to act as the appellate court's boss has not elapsed. Let's take a break here and bring you up to speed with the latest in business, sports and more.
In the last 3 years, we have built a multi-purpose center, which is the envy of all in our constituency. And I can tell you that the people who are living there are already enjoying it.
Guy, do you think what this man just said is true? See, I seriously doubt. I'm sure it's one of those their silly lies.
And wait, do you know there's a way to find out if these things he's saying is true or not? This is the Construct app. It gives people like us a sure way to track implementation of constituency projects. It gives valid and verified information on location of projects, amounts allocated, amount funded, the level of job done, and even the profiles of concerned legislators. You and I can post directly on this app.
Are you serious?
This is the Go-To app if you want to know how our Commonwealth is being expanded by the government.
Wow. Let's even see if what this man said is true. Show me.
The Construct app is developed by Other People Nigeria with support from USAID and is available on both Google Play Store and Apple Store.
And it's true.
Of course, I told you.
The Central Bank of Nigeria has pegged the maximum limit eligible for healthcare research at 500 million naira. This was listed among the CBN's new guidelines for the healthcare sector research and Development Intervention Scheme. In a 7-page circular published on its website yesterday, the CBN said the initiative was part of its policy response to the COVID-19 pandemic. The Apex Bank said the scheme is aimed at financing research and development in new and improved drugs, vaccines and diagnostics of infectious diseases in the country. The scheme is set to boost domestic manufacturing of critical drugs and vaccines to ensure their sustainable domestic supply and reduce the bulk manufacturing cost of the drugs, herbal medicines and vaccines. Armed men dressed in military uniform have attacked a village of Fulani herders in central Mali, killing at least 20 people. The attackers on Friday targeted the village of Binodama in the Mopti region, which has seen dozens of tit-for-tat ethnic massacres over the past few years. Confirming the attack, mayor of the community said between 20 and 30 people were killed by the men in military attire. Mali has been in crisis since 2012 when Al-Qaeda-linked militants seized its desert north. French forces intervened the following year to drive them back, but the militants have since regrouped and extended their operations into the neighboring Burkina Faso and Niger. Serie A club side Napoli says it has no intention of allowing any of its players live below their full value. Addressing the future of Kalidou Koulibaly, the club insists they will not allow the Senegalese centre-back to live in a cut-price deal, adding that the defender's value has not budged during the COVID-19 crisis. Clubs across Europe have been hit by the impact of the pandemic, with the financial toll leading to suggestions it could have a major effect on the transfer market. Koulibaly, who turns 29 later this month, has frequently been linked to the move, including to Premier League duo Manchester United and Liverpool. And that's it at this time of the newsroom. Thank you for watching.